Hi, my name is Sarah Mintz, and I'm going to go through my final exam on quantitative analysis for MPH 516. So the article that I decided to do my final exam on was a qualitative study about cardiovascular disease. The title of the article was Risk of Cardiovascular Disease, a qualitative study of risk interpretation among patients with high cholesterol. A little backstory on what the article was about. In 2008, CVD was and still is the leading cause of death, but accounted for 30% of deaths that year. People tend to not fully grasp the effects of health related to cardiovascular disease, and this study helps explain how people with, for example, high cholesterol, which is a contributing factor of cardiovascular disease, interprets their risk with CVD. A qualitative analysis, it can be very, very beneficial for research. Through collecting data from participants, that can be a great way to determine the needs or direct feedback from them to use to assess their hypothesis. Part of the method section of the study was part of a RISAP study, and their main goal was to develop risk information for patients at high risk of CVD and to evaluate the effect of the number of prescribed cholesterol-reducing medications for CVD and how all that relates. The study was performed in accordance to the Helsinki Declaration, and the main goal of the study was to explore how cholesterol-reducing medications and the risk of cardiovascular disease are interpreted by asymptomatic patients with high cholesterol. Some of the results were found that high cholesterol, from what participants said, was related to everyday events and social life, and due to the risk of that, it was associated with more fattier foods. At the end of the study, they found that half of asymptomatic patients with high cholesterol who initiate medication stop treatment within 6 months and fully decline treatment within a year. All right, so moving into more of the design of the study and how it was set up, what methods they used, data collection, participants, things like that. So they did use an ethnography design, and from the article it's saying that they used this because it supported the connection or relationship between theories, methods, and data and the analytical process. Within this, the way that they got their participants was that they had 15 general practitioners in a focus study. They'd reached out to all of them, but only 5 responded. Within those 5, they asked for them within, I believe it was within the past year, of any patients that they had that met 3 criteria that they had, which was patients who had high cholesterol and high risk of cardiovascular disease, according to the Danish guidelines for prevention of cardiovascular disease in general practice. Second was patients who had received information about cholesterol-reducing medications as a preventative treatment option. And lastly, patients who had no manifest cardiovascular disease or symptoms of it, people who were asymptomatic within that. So out of those 5 general practitioners who agreed within the study, they reached out to 15 patients, 14 of which accepted to do interviews. And from those, there was 8 females and 6 males. Within their interviews, they did interviews with 2 social anthropologists. And kind of some thoughts and concerns that come up with their approaches to this was that a positive that I saw was that the interviews were being conducted in home, and the participants were doing this without remuneration. But being able to do this at home, it kind of gave them more of a calming environment. They weren't in some odd place, someplace new. They were in a familiar place. 8 of them were interviewed individually, and the other 6 were interviewed with their spouses. Like I said, this kind of helps because it kind of gives people that calm sense of familiarness. If they were able to do it with their spouses, they wanted to, but then I can kind of see the negative. Maybe there may be more personal questions that you would not get the full truth or full answer if they have their spouse or somebody else with them versus if it was just a one-on-one. some more things thought was maybe some more activity within the studies, if they had more general practitioners and more participants in general, just to kind of get a bigger understanding of everything. And that they did follow the ethics of the American Anthropological Association, but they were exempt from obligation of notification towards the Danish Scientific Ethical Committee. So lastly, moving into the reliability and the validity of the study, I thought that the findings from the study, from the article, made it credible because it allowed researchers to use the qualitative analysis type of study to get inside information from people to leverage it against the research that's available. In their article, it did mention some like key backup points to this that I wanted to bring up, and it was how the research on the literature was reviewed by the author. And this was looking at risk perception of patients at high risk of future diseases. Secondly, the researchers discussed social theories about risk perception, and then the theories that they used helped structure the interview questions. So from the interviews that they used with the participants, they were transcribed and they had written field notes. And some of the things that become present was what was it like to have cardiovascular disease, what is cardiovascular disease, and then some risk negotiations. Preliminary analysis was done by the researchers as well, and then the themes were used from theoretical perspectives to strengthen the findings about risk. Some limitations that were also mentioned within this was the inability to observe live risk, and that you can only use what the participants said, so they didn't get to physically see or have the research and the study there. They had to use what the patient said, of if they really what they thought. Like, they had to use their words and trust that what they were saying was true. And then, like I mentioned earlier, that only 5 of the general practitioners responded to the study request. So I feel like if they had more participants, then a greater understanding of how people interpret the risks within the cardiovascular disease as well. And that brings us to the end of my presentation. So below you will see my reference that I used for the study article.